Good evening. Welcome to Spectra's Thursday night webinar program. Tonight we bring you nutrient deficiencies caused by pharmaceutical medications presented by Dr. Pamela Smith. Slides for this webinar along with other educational resources are available on the left of your screen in the Learn More box. You may submit your questions in the Q&A box on the left of your screen. We will try our best to answer all of them. At this time, I would like to welcome Dr. Smith.
Thank you so much. Good evening, everybody. I'm going to spend the next hour or so looking at micronutrient deficiencies caused by pharmaceutical medication. Every single prescription that is written causes at least one nutritional depletion. And there's some references there for you. Next. Why is nutrition important? Overwhelming scientific evidence and published medical research documents the role that essential nutrients play in achieving and maintaining good health. The same evidence links nutritional deficiencies as a contributing factor to chronic diseases such as heart disease, cancer, osteoporosis, Alzheimer's disease, diabetes, and arthritis. Nutrient depletions are common. 90% of people are deficient, and 50% of those are already taking supplements. So this is one reason it's important to look at measuring. Every patient has different nutritional requirements as a result of their biochemical individuality. Improper or over supplementation can be harmful, so it's essential to understand each individual's personal nutritional requirements. Sometimes that happens to me in my practice. Patients come in and they will read things on the internet and they'll see different practitioners, and sometimes they're on too many supplements. Micronutrient deficiencies can be caused by commonly used prescription medications. Next. So here you see a reference looking at the idea that the estimated 30% of side effects for medications are related to drug-induced nutrient deficiency. Next. So micronutrient testing will really give us a good idea what these nutritional depletions are. We're going to go through different category areas and look at some of these tonight, the nutritional depletions and potential health problems associated with those. And here you can see a summary slide, next, and another summary slide looking at the different classes of drugs from diuretics to cardiovascular disease, etc., and their nutritional depletion. Next. How can we accurately measure micronutrient deficiency? Lymphocytes are a long-term marker of nutrient status. They contain a complete genome, nucleated cells. They're closely tied to immune function, and lymphocytes are representative of overall health. So they're a really great way to measure micronutrient deficiency. Next. So on a Spectra cell report, I really like the way the reports are done. It's very easy to understand for the practitioner and for the patient. The one you see in front of you is a sample. The testing determines the following nutritional depletions, and it lists things under there. And then there's borderline deficiencies as well. And when you look at the box at the bottom, you'll see that the yellow section is where you really want things to be. Next. Now, I really like this idea because you see the little squares, and the green ones are adequate of that particular nutrient. The black are borderline of that nutrient, and then the red are actual deficiencies. So, for example, if you look down at the very bottom, you will see the third one over is vitamin B2, and it has a red. And so that one would really be a deficiency that would be occurring. Next. And we also look at micronutrient testing. We can look at carbohydrate metabolization. We can look at individual antioxidants. And we can look at the immunodex, which is an indication of the patient's T lymphocyte proliferative response to metagen stimulation related to the response of a controlled population. Next. So let's look at micronutrient depletion caused by class of drugs. Next. Let's begin with antacids. Next. Antacids that contain magnesium and aluminum hydroxide deplete the body of calcium, phosphate, and folic acid. Antacids that contain sodium bicarbonate deplete potassium and folic acid. Next. This is another reference on antacids depleting folic acid. Next. Let's look at antibiotics, very commonly used medications. Antibiotics destroy the good bacteria in the GI tract, and they cause nutritional depletions of B1, B2, B3, 5, 6, 12, biotin, inositol, folate, and vitamin K. This becomes really important when people use antibiotics long-term. For example, the use of tetracycline long-term to treat acne. Very interesting to look at the nutritional depletions that will occur. Next. If you look at gastrointestinal health, let's face it, if the gut's not healthy, the patient is not healthy. So if they're taking an antacid, no one is born with an antacid deficiency. We want to know why they have an antacid, or why they don't have a gut that's working and they have reflux or GERD. They think that they need an antacid because it's affected by everything that you see in this slide when we look at gastrointestinal health. Next. Next. So antibiotics that treat TB, isoniazid depletes the body of B3, B6, vitamin D, calcium. Ethambutol depletes the body of zinc and copper. Retesting depletes the body of vitamin D. Cyclosporin depletes the body of the nutrients listed there. And PABA depletes the body of B12. Next. And next. Aminoglycosides deplete the body of micronutrients that are listed on this slide. Next. Next. Antimicrobial or antimalarial antibiotics, like hydroxychloroquine, given to patients on long-term dialysis, decreases the patient of calcium and vitamin D. So you can see how a patient would develop osteoporosis or some sort of bone loss. Next. Penicillin deplete the body of potassium. All B vitamins, vitamin C, vitamin K, and friendly good GI bacteria. Next. Tetracyclines deplete the body of these. Look at that patient's on tetracyclines for their acne. Look at what they're depleting, including magnesium, which has 300 functions in the body. Next. Trimethoprim depletes the body of folic acid. That's probably one of the ones that is the more commonly known nutritional depletion. In fact, my physician's assistant, we've been working with her when she was first hired in, and she was taking a course in the fellowship, and we looked at nutritional depletions caused by medications, and she came out with tears in her eyes. And I said, Surveya, what's wrong? And she said, my gosh, I've been committing malpractice all these years. I really did not know that every single prescription that I wrote caused a nutritional depletion. So it's very important. Every patient in my practice, I do micronutrient testing on, and then I repeat it again and again, just to make sure that we have the right nutrients replaced. Next. Sulfa drugs and trimethoprim deplete the body of biotin, folic acid, inositol, B vitamins, vitamin K, and friendly GI bacteria. Next. Macrolides deplete the body of these vitamins. Next. Fluoroquinolones. We all know fluoroquinolones are not prescribed as much as they used to be because they can cause tendon damage, but also look at the different nutritional depletions that can be caused by fluoroquinolones. Next. Cephalosporin deplete the body of these vitamins. Next. Neomycin depletes the body of these. Next. Anticoagulants can cause nutritional depletions as well. You can see here barbiturates, phenytoin, carbamazine, trimethoprim, valproic acid. All these deplete the body of different nutrients. The first four, very importantly, deplete the body of vitamin D. If the patient has low vitamin D, it increases their risk of having more seizures. So actually the medications that we're giving the patients for their disease process may worsen the disease in this particular case. So important to look at vitamin D. The patient doesn't have enough vitamin D. It increases their risk of breast cancer, prostate cancer, colon cancer, Parkinson's, MS, diabetes, high blood pressure, cognitive decline, and probably fibromyalgia and polycystic ovarian disease. So you can see how it would be important even if they were just on an anticoagulant. Next. And there's your references. Next. How about diabetes and insulin resistance? If you look at all disease processes in North America, the disease that costs the healthcare system the most is not heart disease and it's not cancer. It's actually diabetes. Next. So when looking at diabetes, we see influence from all these different nutrients: vitamin B12, vitamin B3, vitamin D, vitamin E, C, inositol, carnitine, glutamine, coenzyme Q10 protects the kidney from diabetes and related damage. It also improves glycemic control and type 2 diabetes, glutathione. Lipoic acid, so very important. It enhances glucose uptake in skeletal muscle tissue. It improves glucose tolerance in type 2 diabetes. It's very effective to treat diabetic neuropathy and also to prevent diabetic neuropathy. The same thing with carnitine that's listed on the slide. Very important to prevent and treat diabetic neuropathy. Zinc. Zinc is a cofactor for 100 different reactions in the body. Magnesium, biotin, chromium, vitamin B12. And all of these on the slide very interactive when it comes to insulin resistance and diabetes. Next. And there's your references. Next. So let's look at some medications that we use to treat diabetes and insulin resistance. These sulfonylureas. This class of drugs depletes the body of coenzyme Q10 and vitamin E. Biglanides, such as metformin, the most commonly prescribed drug for insulin resistance, diabetes, and even weight loss, depletes the body of vitamin B12, vitamin E, folic acid, and coenzyme Q10. So I think you can already see tonight that when we look at the idea of Q10, a major fueling source in the body, it's not just statin drugs that deplete the body of this very important nutrient. And this is from the Archives of Internal Medicine, 2006. Next. And here's more reference. Again, looking at diabetes. Next. Insulin can deplete the body, may deplete the body of DHEA. So even insulin itself as an injection may deplete the body of a very important hormone. Next. It's important to look at these markers. On the Spectra cell micronutrient test, there is part that you have with a pre-diabetes test report where you can actually, the pre-diabetes test from Spectra cell, get more of these markers. So you can actually look at glucose and HOMA scores and adiponectin and leptin and hemoglobin A1C and C-reactive protein. You can get a marker on this test by Spectra cell, the pre-diabetes test, and really get a good idea where your patient stands. Next. There's the actual component summaries of each of the things that are listed on there. And that's really good for people who are brand new, along with those of us who've been doing this kind of medicine for a long time. It's always important to have a nice summary right on the test of the different kinds of things that you may or may not have a good explanation of yourself. So it's really nice here to look at C-reactive protein, HSCRP. HSCRP, when we have inflammation, because it's a marker of inflammation, probably 90% of chronic disease is inflammatory in nature. I certainly agree with Jeff Bland on that area. So we can even get this in the pre-diabetes test. Next. Antifungal medicine, amphotericin. I love to call that amphoterrible. Amphotericin depletes the body of calcium, magnesium, potassium, and sodium. Next. Anti-inflammatory medications. Next. Corticosteroids, steroids, deplete the body of all of these. I mean, isn't that amazing? We really don't think about it. When we write a prescription for somebody, for example, that may have lupus, they need long-term steroids, look at all the nutritional depletions that are caused by steroid use. Next. Next. When you look at the idea of inflammation, again, this is a major marker of disease. A small amount of inflammation heals. Too much inflammation actually causes disease, and you can start from the head. Alzheimer's disease and every type of cognitive decline are inflammatory in nature. And you can go to the mouth and look at gingivitis, and you can keep on going through the rest of the body and really look at the idea of inflammation. You can also look at the nutritional status related to this. For example, coenzyme Q10 decreases several inflammatory markers if it's deficient, like C-reactive protein and interleukin-6. You supplement with Q10, and this helps the genes control the response to inflammatory areas. So, very important to look at each of these. Next. Other anti-inflammatory medications, sulfasalazine, indomethacin, salicylate, and even non-steroidal anti-inflammatory drugs deplete the body of folic acid and melatonin. Did you ever wonder that patient that you see on Monday morning? You've done everything in the world to try and get them to sleep. You've measured hormones, you've measured amino acids, fatty acids, organic acids, neurotransmitters. You've looked at micronutrient testing. You've done their cardiac profile and looking at the LPP and everything else. They're still not sleeping. But they're on a non-steroidal. Go back and look at melatonin. They get a depletion there by their non-steroidal they're taking for their arthritis. Next. And there's your references. Next. Anti-Parkinson medication. Levodopa depletes the body of potassium, SAMe, vitamin B6, and coenzyme Q10. Next. Medications for protozoal. Vitamidine depletes the body of the all-important magnesium. Next. Antiviral medication used for AIDS and other diseases depletes the body of the nutrients listed here. Next. Next. Bronchodilators. Theophylline depletes the body of vitamin B6. You want to make sure if the patient's on theophylline that they do get pyridoxal 5-phosphate activated B6, because this drug does deplete the body of the activated form. The study is listed there. Another study showed that supplementing with B6 reduced some side effects of theophylline, like headaches, sleep disorders, nausea, and irritability by just giving pyridoxal 5-phosphate. Next. Beta-adrenergic agonists deplete the body of potassium, phosphorus, calcium, and magnesium. So if you look at asthma, I mean, you can do this with every disease process you can think of. Let's look at Q10 again. Steroid medications for asthma cause damage to the mitochondria, the site of cellular energy production. Q10 goes back and repairs all of that. Let's look at choline. I mean, these cell membranes are made of phosphatidylcholine and phosphatidylethanolamine. In both animal and human studies, it shows that taking choline strongly suppresses oxidative stress to the lungs caused by asthma. So you could do that with each of the nutrients here. You really can't pick out a single nutrient that is not important. Next. And there's your references. Next. Cardiovascular medications. Cardiac glycosides like digoxin deplete the body of calcium, magnesium, phosphorus, and vitamin B1. One of the big treatments for arrhythmias is magnesium. If the patient's becoming hypomagnesiemic, meaning they have low magnesium levels from their digoxin, all it does is it sets them up for an increased risk in having an arrhythmia. But you really don't know that unless you look at nutritional depletions caused by medicines, and you can document this by doing a micronutrient test. Next. Antihypertensive medication. Hydralazine depletes the body of B6 and coenzyme Q10. Next. Loop diuretics deplete the body of potassium, magnesium, calcium, B1, B6, vitamin C, sodium, and zinc. It's not just potassium. That's what most of us think. Some of us might think potassium and magnesium, but the rest of them as well. Next. Potassium-sparing diuretics sounds really grand. It's potassium-sparing, but potassium-sparing diuretics deplete the body of calcium, folic acid, magnesium, phosphorus, and zinc. Next. Thiazide diuretics deplete the body of magnesium, potassium, sodium, zinc, and coenzyme Q10. The number of medicines you're seeing here that deplete the body of Q10. Next. Beta blockers. Here's another medicine that depletes the body of Q10. Also looking at the idea of melatonin. It's depleted by beta blockers. There's no depletion of chromium caused by beta blockers. However, beta blockers can lower HDL. To combat that, clinical pearl. Give 200 micrograms of chromium, and it will help combat the issue of a lowered HDL caused by beta blockers. Next. ACE inhibitors. The most commonly used medication as an antihypertensive, depletes the body of zinc, also has the potential of depleting the body of the rest of the nutrients listed on the slide. Next. Angiotensin II receptor blockers, otherwise known as ARBs, deplete the body of zinc, calcium, magnesium, phosphorus, and CoQ10. Next. Chlorothalidone depletes the body of zinc. Next. Central acting medications like clonidine and methyldopa deplete the body of coenzyme Q10. Next. Calcium channel blockers deplete the body of vitamin D, magnesium, potassium. All of these are hugely important, but unless you measure, you really don't know, because every person's an individual, how bad these nutritional depletions are. Next. There's your reference. So looking again here at this disease process, hypertension, let's take magnesium. It promotes the dilation of blood vessels. It lowers intracellular levels as well as established cause of hypertension if a patient has low magnesium. We mentioned vitamin D and hypertension. Low vitamin D strongly linked to hypertension, possibly due to its role in calcium transport. So it's important to look at all of these again with almost every disease process you can think of. Next. And here's your references. Next. Cholesterol-lowering medication. The most commonly prescribed drugs in the country, next, are statin drugs. The statin drugs cause a lot of nutritional depletion. We all know about coenzyme Q10, that it causes depletions of selenium. Selenium, very, very important. The pattern of side effects of statin drugs resembles selenium deficiency. Depletes the body of carnitine, another major fueling source in the body. Again, vitamin D, magnesium. Again, so important to look at nutritional depletion. Next. Here's your references. Next. So here we are, H and G-CoA reductase inhibitors, most commonly prescribed drug in the world. Depletes the body of coenzyme Q10, vitamin D, vitamin E, both tocophenols and tocotrienols, omega-3 fatty acids, zinc, carnitine, selenium, copper, vitamin K2, vitamin A, and creatine. It may also interfere with vitamin K and selenium. So, huge issue with statin drugs. Doesn't mean you don't prescribe them. And when you prescribe these medications, you want to make sure you backfill with the nutritional depletion caused by them. Next. And there's your references. Next. Bile acid sequestrant, cholestyramine, depletes the body of everything fat soluble, along with B12, folic acid, beta-carotene, calcium, iron, magnesium, phosphorus, and zinc. Cholestyramine is now getting big play in the treatment of mold. So I think actually now more cholestyramine with functional medicine practitioners is used for the treatment of mold than it is to lower cholesterol, but it still depletes the body of everything listed on the slide. Cholecystyrol depletes the body of the nutrients listed here as well. Next. Fibrates deplete the body of vitamins E, copper, zinc, and B12. Fibrocil depletes the body of CoQ10, vitamin E, and gamma tocopherol. Next. Electrolyte replacement. Time-release potassium chloride can deplete the body of vitamin B12. Next. Female hormones. Next. Oral contraceptives. Again, one of the top 10 most commonly prescribed medicines in the world. Deplete the body of folic acid, B1, B2, B3, B6, B12, vitamin C, vitamin E, magnesium, selenium, zinc, and tyrosine. All my patients that are on estrogen of any variety, because estrogen is the component here that's causing most of these nutritional depletions, whether it's birth control pills, patches, IUDs, natural or synthetic hormones, they have estrogen, they deplete the body of all these things. So important to go back and replenish them. Next. There's your references. Next. Estrogen replacement therapy itself, natural or synthetic, again depletes the body of these nutrients. Next. There's your references. Next. So estrogen, you can see here in this very nicely done slide, looking at the importance of selenium. Estrogen levels affect how selenium is distributed to various tissues in the body. And selenium is such an important antioxidant. There are so many studies showing that selenium helps prevent almost every cancer there is. Let's look at zinc. Estrogen lowers the risk of zinc deficiency. There's zinc issues. We've got to measure all of these. Next. And there's your references. Next. Gout medication. Colchicine depletes the body of B12, sodium, potassium, beta-carotene, calcium, and phosphorus. Next. Mineral oil laxatives deplete the body of everything listed here on this slide. Next. There's your references. Next. Psychotherapeutic medication. Let's start with the tricyclic antidepressants. Next. Tricyclics deplete the body of vitamin B2 and coenzyme Q10. Next. SSRI deplete the body of melatonin and iodine. And then you wonder what happens. The patient's on an SSRI, they say they can't sleep. Go back and look at melatonin. The patient's thyroid becomes dysfunctional. Go back and look at iodine. Interesting things to look at with SSRIs. Next. SARIs deplete the body of coenzyme Q10 and B12. Isn't it amazing when you look at this, how many of the medications, if you just looked at coenzyme Q10, deplete the body of this important fueling source? Next. Phenothiazine deplete the body of B2, coenzyme Q10, and melatonin. Next. Monoamine oxidase inhibitors. Phenazine depletes the body of vitamin B6. Next. Haloperidol depletes the body of, again, melatonin and vitamin E. Next. Lithium depletes the body of inositol. I learned this from Jonathan White, and it's really a great clinical pearl. Most of us, because we do a nice anti-aging functional medicine approach, we use a lot of theanine. You know, theanine is great for mind chatter, 1 to 200 milligrams BID, and it really works best if you give it BID because you need to settle the brain down. I learned from Jonathan Wright another really good thing to do is to use inositol, 9 to 12 grams to settle down the brain. If that patient can't sleep, you can have compounded inositol, 9 to 12 grams, have them take it at nighttime. Very good for sleeping. Remember, lithium depletes the body of this very important B vitamin. Next. Barbiturates deplete the body of melatonin. And actually, there's been a couple of studies showing that you see this depletion with just one dose of barbs. Next. ADHD, very, very common disease process. When you look at ADHD, most of these patients have magnesium deficiencies with ADHD. Magnesium deficiencies are linked to poor function of neurotransmitters that are involved with very important control of emotion, social reactions, hyperactivity. Those studies are showing that if you give patients with ADHD magnesium, they do better. Great studies on carnitine and ADD. A phenomenal study on young boys, and using carnitine reduces hyperactivity, improves social behavior. So again, if we measure, then we know what nutritional depletions are there. Next. There's your references. Next. Anxiety. Oh, this is one that sometimes I just feel so bad for the patient when they have anxiety. I really do feel terrible. And then sometimes it just compounds themselves because patients can't control the situation. They become more anxious. Chromium has a major effect on serotonin transmission that can explain some of this anxiety that people occur. And so if you replenish chromium, it can reduce what happens with anxiety. Same thing with magnesium. It regulates the HPA axis. It controls physical and psychological reactions to stress. Deficiency can induce anxiety and emotional hyperreactivity. The patient doesn't have enough magnesium. There's so many things to look at. Zinc. Zinc reduces anxiety in clinical trials, probably due to its NMDA receptors in the brain, which regulate mood that interact with zinc. So important to look at that mineral as well. Next. And there's your references. Next. Depression. And you can go through each of these. Patients that are depressed, they've gone to 11 doctors or other clinicians before they met you. And they've tried everything there is to try as far as medication is concerned, but perhaps they haven't looked at nutritional depletion. Very important, again, to look at chromium. That elevates serotonin. Important to look at vitamin B6. It's a cofactor for serotonin and dopamine production. Again, we can go through all of these. Inositol influences the signaling pathways in the brain. So, again, we would like to measure these and see what the patient needs. Because really, in 2017, it is about personalized medicine, a customized approach for each patient. Next. And there's the references. Next. Anabolic steroids deplete the body of iron. Next. Thyroid medicines. T4 supplementation depletes iron. Next. You look at hypothyroidism. A lot going on with the conversion of T4 to T3. So all these nutrients here. Selenium, again, important. Converts T4 to T3. Deficiency reduces T3 levels. In the patient, as you know, T3 is stronger than T4. Choline. Hypothyroidism negatively affects choline function in the brain. We want to go back and make sure we get the appropriate conversion of T4 to T3, which requires iodine and B vitamins and selenium to occur. Next. And there's your references. Next. Medications for ulcers. Next. H2 blockers deplete the body of vitamin B12, vitamin D, calcium, iron, zinc, and folic acid. Next. There's your references. Next. Protein pump inhibitors. Again, in the top 10 drugs prescribed in the world, not just in North America. They deplete the body of B12. They also decrease the absorption of magnesium, calcium, iron, vitamin C, and beta-carotene. Next. There's your references. Next. Other medications. Next. Methotrexate depletes the body of folic acid. Next. So important to really now look more at methylation. And so I do a lot of methyltetrahydrofolate reductase gene testing and looking at this very important SNP. This is a Spectra cell test as well. It's important. We think at least 40%, maybe 50% of people actually have the SNP for one of these different issues with methylation. So there's many ways to look at this. But we know for patients that have the SNP, they have an increased risk in homocysteine. High homocysteine increases the risk of heart disease, stroke, depression, cognitive decline, and bone loss. So increased risk in many disease processes if you don't look at the methyltetrahydrofolate reductase genotype. Next. Penicillamine depletes the body of these nutrients. Next. Orlistat depletes the body of really everything fat-soluble. Next. Xenocol depletes the body of everything fat-soluble as well. It has amazed me that some of these things have gone over the counter because then you get depleting everything that is fat-soluble. Next. Weight management. Looking at weight management. Again, it's really not just calories in and calories out. If it was that simple, everybody would be the weight they want to be. So what do? We want to look at a personalized approach. So I do a micronutrient test on all my patients that I want to look at weight management in. Vitamin D deficiency strongly linked to poor metabolization of carbohydrates. Chromium makes the body more sensitive to insulin. It helps to reduce body fat, increase lean muscle mass. Carnitine carries fatty acids into the cells so they can be burned as fuel. Each one of these that you see in the slide, very important for weight management. It's a multifactorial problem that the patient cannot lose weight. Next. And there's your references. Next. Potassium, the extended release potassium depletes the body of B12. Next. Bisphosphonate, not my favorite drug, but they do deplete the body of just so very interestingly, calcium, magnesium, and phosphorus. These are the nutrients that we need to build bone. And this is a medication we're using to treat bone loss with. Again, an interesting scenario, depletion of calcium, magnesium, and phosphorus by bisphosphonate. Next. Plaquenil depletes the body of calcium, vitamin B6, vitamin D. Next. Over-the-counter medication also cause nutritional depletion. Sometimes people really don't think about this function at all. They don't realize when they take something over the counter that this may be causing them a major problem if they're doing it long term. Next. Acetaminophen depletes the body of glutathione, the strongest antioxidant that there is. Next. Now let's look at micronutrient depletion by medication type. Next. Drugs that deplete beta-carotene. You can see on here, again, cholestyramine. Next. Drugs that deplete the body of bifidobacteria bifidum are listed here. Next. Drugs that deplete the body of biotin. True story. A patient came into my practice with the chief complaint that she kept losing hair. And she couldn't figure out what the issue was with her hair loss. And she had been to so many practitioners. She went to an anti-aging doctor to actually have hair supplemented and transplanted in. I mean, she went to great lengths about her hair. And when she came to see me, I looked at her and I said, "You're on phenobarbital." And she goes, "Well, yes, I've had seizures since I was 12. I said, "It depletes the body of biotin. We need to give you some biotin, then you'll end up having more hair growth. The biotin B7 is for hair and nails." We gave her a big dose of biotin, 5 milligrams, not micrograms that we usually give, but 5 milligrams. And in 6 months, she was very happy with her hair. But again, it's important to look at these nutrients. Next. Drugs that deplete the body of calcium. You notice that estrogen is on the slide. Digoxin is on the slide. Next. More drugs that deplete the body of calcium. Of course, None of us are going to remember all of this. The slide here is to really, the seminar tonight is not to give you an exhaustive list of every single medication on earth that causes a nutritional depletion. The idea is measure. Do a micronutrient test and look at the nutritional depletions anytime the patient's on a medicine. Also look at nutritional depletions just in general, because as people age, they get nutritional depletion. Starting at about the age of 50, the body on its own, even if the patient is very healthy, makes less carnitine, less alpha-lipoic acid, and less CoQ10. So less carnitine, less CoQ10, and less alpha-lipoic acid. By the time the patient's 60, most patients are on at least one medicine, even if that single medicine is hormones. Next, drugs that deplete the body of carnitine, again, a major fueling source. Next, drugs that deplete the body of chromium, corticosteroids. Next, drugs that deplete the body of coenzyme Q10. There's more than one slide here. These are in alphabetical order. You can see on the slide we're only on D. So, I mean, it's amazing. Statin drugs, beta blockers, metformin, glyburide, glipizide, hydrochlorothiazide. I mean, it's exhaustive that depletes the body of Q10. Next slide. These drugs as well deplete the body of Q10. Next slide. These drugs as well deplete the body of Q10. Next slide. These drugs deplete the body of copper. Next slide. These drugs deplete the body of folic acid. There's our cholestyramine again. OX2 inhibitors deplete the body of folic acid. Estrogens deplete the body of folic acid. Next slide. Same thing with these. They deplete the body of folic acid. Here's our hydrochlorothiazide again. There's our metformin, oral contraceptives. Next slide. These drugs deplete the body of inositol. Next. These drugs deplete the body of iron. True story. A patient came in to see me who wanted to know what she could do to maintain iron without having to have IV iron all the time. She was just frustrated. She had to go in once a month to have IV iron. And she said, my neighbor told me to come and see you. I want to know, is there anything else in the world I can do? I said, well, you know, it's not something we can really compound and put on the skin. A lot of times, if you can't get a nutrient into the body, like the patient's low in magnesium, you can just compound magnesium chloride, 10% cream, and lipoderm, with a good base lipoderm. So that's magnesium chloride, 10%, and lipoderm. You can just have that compounded and put on the skin. The patient's magnesium deficient, they'll get magnesium. But you know what? You can do that with vitamin D. Gets into the skin really well. But iron is a big molecule. You really can't compound it and put it on the skin. So that was not the answer. It was very surprising to her what the answer was. She was on levothyroxine. And because it depletes the body of iron, we ended up going back and we worked with her on her nutritional depletions. And we ended up changing her to only T3, which we could do because when we measured the labs, we measured them over and over. It allowed us to put her on T3 only. We had that compounded for her, and she was no longer depleting iron in 90 days. And there's your references. Next slide. Next slide. These drugs deplete the body of lactobacilli. Next. These drugs deplete the body of the all-important magnesium. Almost every patient is magnesium deficient. Interestingly, here again is cholestyramine. Depletes the body of not just the fat-soluble vitamins, but also magnesium. There's your digoxin. There's your estrogen. Next. This next slide also looks at the depletion of magnesium by these drugs. So I hope that Monday morning we all go back and we look at our patients from a little different viewpoint when they come in to see us, and also when we consider initiating medications that we want to give them. Next. Here's drugs that deplete the body of melatonin. Next. These drugs deplete the body of phosphorus. We don't talk about phosphorus much because we get a lot of phosphorus in our diet, and so people are not usually depleted in phosphorus, but they certainly can be if they're on any of these things. Next. These drugs deplete the body of potassium. Again, all important. Patients can have AFib and other arrhythmias if they're deplete in potassium. It's not just diuretics. It's all the things that are listed here. And you can see, again, they're in alphabetical order. We're only on H. Next. These drugs also deplete the body of potassium. Next. Levodopa depletes the body of SAMe. Next. Corticosteroids, oral contraceptives, and valproic acid deplete the body of selenium. Next. These drugs deplete the body of zinc. Again, a lot of commonly used drugs are on this list. Next. Again, another slide on zinc. These medications, oral contraceptives, are sitting right here. Tetracycline, Trimethoprim, some commonly used medicines deplete the body of zinc. Next. These drugs deplete the body of sodium. You notice SSRIs are on this list. And think about it. When you see that patient on Monday morning, I mean, we've all seen this. They're on Zoloft, they're on Paxil, they're on Prozac, and we see low sodium. It's just slightly low. We go, well, gosh, I wonder why that is. Maybe it's not low enough I want to do a workup, but there may be the cause. Cause is their medication. Next. Drugs that deplete the body of vitamin A are listed here. Next. And drugs that deplete the body of thiamine. Next. Next. Here, drugs that deplete the body of riboflavin B2. Next. Here's more drugs that deplete the body of riboflavin. Next. There's your reference. Next. Here's drugs that deplete the body of niacin. Notice estrogens are on this list, both conjugated and esterified. Oral contraceptives as well. Next. These drugs deplete the body of pantothenic acid, aspirin, and salicylates. That's from the line of Calling Institute. Next. These drugs deplete the body of pyridoxine. Again, some commonly used medications on this list. Next. And here's more drugs that deplete the body of B6. Next. There's your reference on that one from Neurology 2003, looking at L-DOPA. Next. Here's drugs that deplete the body of B12. Again, they're in alphabetical order, so yes, there is another slide. Next. Again, drugs depleted by B12. Next. There's references. And next, more references. Next. These drugs deplete the body of vitamin C. You notice on here are oral contraceptives. Also is aspirin. How many of your patients are on one aspirin a day? They're depleting vitamin C if they are. Next. These drugs deplete the body of vitamin D. Next. So again, looking at vitamin D, you can look here at the aging process, telomeres, the protective DNA on every gene, these shorten over time. this shortening of the telomeres, which is really the aging process of the body, is affected by vitamin D. Vitamin D helps preserve the telomeres from shortening. You can look at vitamin D from many perspectives. We haven't talked about fertility, but vitamin D for both men and women. Vitamin D increases sperm motility. It regulates sex hormone production. It helps fertilization occur, so very important. Vitamin D for many things. You can look on here, the immune system, very important. Vitamin D is actually a hormone. It's an anti-inflammatory agent. One of the most important things we will ever measure. Now, when you look at vitamin D, you want the levels to be optimal, but there is a caveat to that. So this is on your micronutrient test. One caveat to that is there's 3 groups of people that you can't optimize vitamin D levels in. Those 3 groups of people are people with an active cancer. If you try and optimize it, make sure you really look at calcium, because if you optimize it, calcium may go up. People with sarcoidosis, TB and Crohn's, people in those disease processes, and people with hyperparathyroidism. Those people with granulomatous diseases, people with hyperparathyroidism, and people with an active cancer, it may be a problem optimizing vitamin D. Again, very important to look at vitamin D and calcium. Both are on the micronutrient test. Next. Drugs that can deplete by vitamin E are listed here. Next. There's your references. Next. Drugs that are depleted by vitamin K are listed here. Next. And then when we look at nutrient repletion, next. Again, we want to look at lymphocytes, long-term marker of nutrient status. Lymphocytes contain a complete genome. They're closely tied to immune function, and they're very representative of overall health. That's why I really like doing the micronutrient test. With the lymphocytes, it really gives me a good idea of nutritional depletion. Next. So again, here's a sample report. Next. Here, the patient was depleted in oleic acid and vitamin K, so it tells you right on the report how much you need to give. Next. So here's a nice summary slide looking at nutrients, their potential, what they do, what is found, and possible symptoms and problems that occur or can occur if the patient has a deficiency in that nutrient. A nice summary slide there for you. Next. I hope this gives you an interesting view tonight. Not an exhaustive view of, oh my gosh, I've got to learn everything on these slides, but really a resource for you. So understand that every single prescription that you are prescribing or a practitioner you're working with is prescribing causes at least one or more nutritional depletion. A great way of evaluating that, because we're all scientists, is to do a micronutrient test so that we have science to back us up. We want to go back and replenish these very important nutrients for the patient. Again, in 2017, it's very much about a customized and individualized approach for every patient. Patients will react differently to nutrients, so you need to go back and remeasure again with the micronutrient test after they're on the nutrients to make sure you have optimal levels. Do we have questions this evening?
Hi, Dr. Smith. I'll send you questions. How much time between retesting for micronutrients?
Oh, that's an excellent question. Part of it, I think, depends on how sick the patient is. For my patients that are there that, are pretty healthy, or they're there to see me for hormones or gut health, I usually measure them, and then I measure them on a yearly basis. For my patients who are really ill, I might measure them, and then in 3 months measure them, and then in 6 months measure them again. They get 3 tests in 1 year if they're really ill.
Okay, our next question. Do the anticonvulsants such as Keppra have the same deficiency issues as the anticonvulsants that you listed in your slides?
Very close to, yes. I just don't have as many references on that particular medication, but yes, they're very close.
Okay, I'm just waiting for the next question. Okay, what would be your thought process approach to telling a patient about SpectraCell's micronutrient test?
Well, usually it's very interesting. That's a really good question. In my personal practice, it really is a customized, personalized approach, and my practice is called the Center for Personalized Medicine for that reason. So the patients do expect, they're going to get something different that they're not going to get from their primary care doctor. And it depends on why they're there. If someone's coming in to see me that is an elite athlete, then we're looking at nutrients because people that exercise more than 4 days a week actually get nutritional deficiencies caused by their exercising, because they're aggressive with exercisers. So I approach it from that viewpoint. If they're on medicines, I may approach it from that viewpoint. If they are deficient in energy, as people age, again, they make less of these healing nutrients. So we need to measure these. It's just a simple blood test, and we can see which nutrients you're depleting. Let's go back and replenish those, and then you'll have more energy. So a lot of it has to do with their chief complaint.
Okay, our next question, does natural thyroid deplete the body of nutrients?
That's an excellent question. I do not know the answer to that. I'm researching that now. So stay in contact with your SpectraCell representative, and I promise you, because I'm researching that actively now, I will get back with SpectraCell within 30 days if I can find any that are caused by unnatural thyroid supplementation that's T3 and T4 combo.
Okay, you mentioned oral contraceptives. However, are there any nutritional deficiencies associated with IUDs?
If the IUDs have hormones in them, yes. So if they're just progestin only, not a lot of nutritional depletion. If the IUD has estrogen in it, then yes, the same ones as oral contraceptives.
What nutrient deficiencies seem to be most common with anxiety and OCD?
Oh, well, that's another great question. These are great questions, truly. Anxiety, again, we mentioned, inositol can be certainly one of those. It's usually a combination of things when we look at these. Amino acids commonly play a major role. Neurotransmitters play a major role as well in both anxiety and OCD. You can add ADD into that. And there's many ways of evaluating this. You can obviously measure amino acids and neurotransmitters. But it's also important to look at the cofactors that are involved in looking at the pathways, because looking at the pathways are very important too. How do you measure the cofactors that are involved in those pathways? I just mentioned amino acids, important for OCD, important for anxiety. B6, a major cofactor for most of the amino acids in the body that are produced, that are regulated. And so, important to do the micronutrient test so you can see if they're deficient in B6, for example. So I'd like to be able to look at the cofactors too.
Are there any instances where the prescribed medicine and the necessary supplemented vitamin and or mineral uses the same metabolic pathway?
Yes, there's a couple of instances and that, yes, there are. There's a couple and it makes it tricky, but there's only one or two of those. So not usually, let's put it that way.
Okay, this is going to be our last question. Can a copper IUD create a deficiency in zinc due to the imbalance?
According to the company that makes copper IUDs, no. It would make certain, you certainly can think of a mechanism where that may happen. So again, in this type of patient, it would be important, even with a copper IUD, it doesn't have hormones on it, but because it is made of copper, you would still want to look at a micronutrient test and see if you have a deficiency.
Well, thank you so much, Dr. Smith, for your expertise tonight.
Thank you very much.
We are out of time for more questions. We sincerely hope you have enjoyed this webinar. Be sure to visit our website, www.spectracell.com/webinars, for next month's webinar announcement. Have a good evening.
Thank you, everybody.